If you wake up bloated, if odd or unusual things trigger a swollen or painful abdomen like tight pants or leaning up against a counter, if your bloated belly is triggered more by cycle timing than by a greasy meal, or if you are always just bloated, this isn't a digestive bloat. This is endo belly. Welcome back to the Endo and Fertility Space channel. In today's video, I'm talking about what endo belly actually is, how it differs from regular digestive bloating, and what blood markers can give us clues about what's going on. Lastly, we'll go through both natural and medical management strategies, including diet tweaks, supplements, manual therapies, and pharmaceutical options for improving endo belly symptoms. If you haven't already, please give this video a like, share it with a friend, and hit subscribe. Now on to the video. So what is endo belly and how does it differ from a regular bloating? Endo belly is not your average bloat. It's a combination of inflammation, fluid retention, slowed digestion, hormonally driven swelling caused by endometriosis. Things like gut imbalances, estrogen dominance, nervous system dysfunction, and histamine can also contribute to the intensity of endo belly bloat. Unlike regular bloating after a big meal or a carbonated beverage, endo belly often appears suddenly and dramatically. The belly can expand several inches within hours. It is painful and accompanied by pelvic pressure, cramping, or nausea. It tends to last longer than a digestive bloat, sometimes days, not just a few hours, and it can worsen during menstruation and or ovulation due to inflammatory and or hormonal changes. This happens because endometriosis lesions release and can trigger inflammatory chemicals, alter movement of food waste and bacteria through the digestive tract, increase inflammation in the gut, and cause visceral hypersensitivity. Visceral hypersensitivity refers to an abnormal sensitivity to pain or pressure of internal organs like the gut, bladder, or uterus. So what are some blood markers that may offer clues? Well, there's no single endo belly blood test. Certain lab findings can give valuable context. Specifically, markers that indicate inflammation can be helpful. One of these lab markers is CRP, C-reactive protein. This is a marker of general inflammation. Elevated levels can signal systemic inflammation. Chronic low-grade elevations are common in women with endometriosis. ESR is another marker of general inflammation that can elevate with inflammation-driven endobelly. CA-125 can sometimes elevate in endometriosis due to irritation of internal tissues and organs by nearby endometriosis lesions, by deep infiltrating endo, or large endometriomas. High ferritin can indicate an inflammatory state. High ferritin in the presence of low serum iron can indicate chronic inflammation, as ferritin is an acute phase reactant. This term acute phase reactant means it elevates when inflammation is high. For more on iron, see my video linked in the show notes below. CBC markers like white blood cell counts or elevations in any immune cell on a CBC, inclusive of high neutrophils, lymphocytes, monocytes, basophils, or eosinophils, can suggest inflammation or immune dysfunction as well. These markers are especially helpful if they are chronically elevated year after year or month after month through testing. A couple of other helpful markers to explore include things like low vitamin D, as low levels worsen inflammation, high fasting insulin or glucose, as blood sugar fluctuations can worsen bloating, drive inflammation, and promote the growth of endometriosis lesions, low homeocysteine, which is needed to make your body's master inflammation fighter, glutathione, and AST and or ALT, your liver enzymes. Because the liver plays such an important role in detox, estrogen elimination, thyroid hormone conversion, and vitamin and or mineral storage, high enzymes can be a sign of inflammation. And speaking of thyroid, labs like a low free T3 and or low free T4 can also provide context, as research shows hypothyroidism, a sluggish thyroid, is associated with more severe symptoms of endometriosis and more aggressive symptoms of endometriosis. So what are some natural strategies for improving endobelly symptoms? Because endobelly is partially caused by inflammation, diet tweaks that provide anti-inflammatory nutrition top this list. Focus on omega-3 fatty acids from oily fish like tuna, salmon, mackerel, sardines, or anchovies, colorful vegetables, turmeric, and cruciferous vegetables for liver support. Daikon and broccoli sprouts are the two most concentrated dietary sources of a powerful anti-inflammatory liver-supporting compound called sulforaphane. Integrating these foods in your diet can often go a long way to improve inflammation and support your liver. Anti-inflammatory teas like green tea, ginger tea, and turmeric tea can be helpful, easy additions to an anti-inflammatory diet. Olive oil is an amazing source of monounsaturated fatty acids, which are amazing for reducing inflammation, supporting insulin sensitivity, and balancing your anti-inflammatory cholesterol with your pro-inflammatory cholesterol. Prioritize proteins cooked using high moisture, low heat cooking methods to maximize the nutrient availability and for reducing inflammatory reactive oxygen species formation. In addition to adding all these wonderful foods in, be sure to remove pro-inflammatory foods like processed sugars, processed grains, and processed meats. For more on this topic, see my video on 6 pro-inflammatory foods to avoid with endo. I'll link that in the show notes below. Other diet tweaks might involve trialing a treatment diet. If bloating is severe, temporarily removing high FODMAP foods like garlic, onions, and beans may help while gut healing occurs. Another treatment diet that I prefer is the biphasic diet. This diet is similar to a low FODMAP diet, except that it prioritizes foods that don't ferment aggressively, but are good for the large intestine microbiome. I'll link to my free gut guide in the show notes below. Inside you'll find a basic version of the biphasic diet. In addition to eating anti-inflammatory foods, avoiding pro-inflammatory foods, and trialing a treatment diet, you will also want to adopt digestive health foundations and optimal meal structure for avoiding strong drops and spikes in sugars. Some of these digestive health foundations include things like eating seated and without distractions, chewing 30 times a mouthful, avoiding hydrating with meals as to not dilute digestive juices, spacing your meals 3.5 to 4 hours apart, and structuring your meals to include protein, fat, and fiber. While endobelly is often not a result of digestive dysfunction, you certainly don't want endobelly overlapping or compounding on top of digestive bloating or vice versa, as this will most definitely skyrocket symptoms and reduce your quality of life. To avoid sharp spikes and drops in sugars, eat protein, fat, and fiber with each meal. The combination of these 3 food categories allows for a steady and slow release of sugar into your bloodstream from your meal. Additionally, combining these 3 food categories helps maximize nutrient absorption as they contain complementary nutrition. What about some supplements that can help with endobelly symptoms? If you are someone who is looking to help reduce endobelly through supplementation, consider what might be at the heart of the endobelly to target supplements appropriately. What I mean by this is if your endobelly is suspected to be inflammation driven, consider only potent anti-inflammatory products like high EPA omega-3s, aim for 3 grams daily, concentrated turmeric products like Curamed, SPM Active, Inflammatone, NAC up to amounts of 1800 milligrams per day, or transresveratrol around the 600 milligram dose. If you suspect your endobelly might be partially hormonally driven, consider products like Yarrow Formula's Brocomax, up to 4 capsules daily, NAC, transresveratrol, omega-3s, and active B complex, magnesium, choline, or quercetin between 3 to 600 milligrams. Caution with quercetin though if you have a slow COMT. If you suspect your endobelly might be partially nervous system driven, consider supplements that support nerve health and integrity like PEA at doses up to 400 milligrams daily, omega-3s, turmeric, alpha-lipoic acid around doses of 3 to 600 milligrams, or acetyl L-carnitine, or supplements that calm or support the nervous system like magnesium glycinate, electrolytes, or adaptogenic herbs like ashwagandha. If you are simultaneously looking to support digestive function, supplements like digestive enzymes, digestive bitters, glucolytic, fodzyme, probiotics, prebiotics, or zinc might also be worth considering. So what about some manual and or physical therapies for endobelly? Manual therapies like cupping, massage, pelvic physio, castor oil packs, or gentle movement can also play a profound role in improving endobelly symptoms. Abdominal cupping or gentle visceral massage can improve lymphatic drainage and relieve tight fascia. Simply apply some lotion or castor oil to the abdomen and run a small cup with light suction horizontally and vertically across the abdomen 10 times each. Pelvic floor physiotherapy addresses tension and improves gut motility. Castor oil packs promote circulation and relaxation in the abdomen. Gentle movement like yoga or walking helps digestion, promotes motility, and reduces stress-related bloating. What about some pharmaceutical and or medical therapies? If lifestyle and nutrition alone aren't enough, medical options can help. Progestin therapy or hormonal IUDs can reduce activity at the level of the local endo lesions and reduce inflammation. Caution with IUDs ladies with endo belly, as many people anecdotally report a sensation of a bowling ball in their abdomen when it is inserted. Gonadotropin releasing hormone analogs lower estrogen production, but should be monitored carefully. If you have large endometriomas or suspect hormones play a big role in your endo belly symptoms, these medications can help, but caution, as they are notorious for causing low estrogen symptoms and bone health decline. Pain relief medications like NSAIDs or selective COX-2 inhibitors can reduce pain and inflammation short term. Keep in mind that these medications don't just target pro-inflammatory chemicals, but they also target anti-inflammatory chemicals and deplete glutathione. If you suspect a digestively driven bloat or endo belly that is made worse through the presence of bacterial overgrowth, pharmaceutical antibiotics or herbal antimicrobials can be wildly effective for reducing things like SIBO and the bloat symptoms that go along with it. Bioidentical progesterone is another incredible intervention to consider. Progesterone is such a superstar hormone for blocking pro-inflammatory chemicals, aromatase activity, and growth factors at the level of the endometriosis lesions. This is a great natural hormone to consider tacking onto your luteal phase if you can have it prescribed. Alternatively, you can access a topical cream through Rena. LDN, or low-dose naltrexone, acts on the endocannabinoid system, helping with endorphin production to reduce pain. It's also a helpful tool to consider if you suspect nervous system involvement or visceral hypersensitivity as part of your endobelly bloat causes. Low-dose naltrexone blocks inflammatory chemicals that sensitize nerve fibers and amplify pain. LDN also supports the nervous system by re-engaging the rest and digest branch of the nervous system to support digestion, sleep, and recovery. If you want to learn more about LDN, I'll link to that video in the show notes below as well. In cases where endometriosis lesions are physically contributing to bloating or bowel obstruction, surgery may be necessary. Always work with a healthcare provider, ideally one familiar with both endometriosis and gut hormone interactions. All right, so a little final note to conclude our video today. Endobelly is your body's way of saying something deeper is happening, whether that's inflammation, gut imbalances, or hormonal shifts. The goal isn't just to manage the bloating, but to heal the root trigger. If you found this video helpful, make sure you give it a like, subscribe, and check out the links in the show notes below for my Endo Belly to Bombshell course and or the free gut guide. And I will see you in the next video.